Howdy friends, on this video we'll cover Walker pages 207, 209, and 211, or should I say some of the features on those pages, not all of them, but we'll do it in a way which will make it hopefully make sense to you. We'll start with the lower leg. The tibia is obviously the landmark which we can all feel on our own legs, and it's the good starting point for this video. We've got three sets of muscles lateral to the tibia and three muscles posterior to the tibia, which are more or less symmetrical with each other. Anterior tibialis, extensor hallucis longus, extensor digitorum longus. You can only see the extensor hallucis longus in the inferior part of the leg where it emerges between the other two. And posteriorly, if this is the tibialis anterior, then this tendon and muscle above it would be the tibialis posterior. Adjacent to it, the flexor digitorum longus, and posterior to that, the flexor hallucis longus. So these muscles are more or less symmetrically located with respect to the long axis of the tibia. Tibialis anterior, extensor hallucis longus, extensor digitorum longus. Tibialis posterior, flexor digitorum longus, flexor hallucis longus. One other set of muscles that we see, which are illustrated on Dr. Walker's page 211, are the muscles of the lateral aspect of the leg, the fibularis longus and brevis. Which one's which? Well, I always say to myself, if you're on the outside track on a racetrack, you have a longer way to go. So this is fibularis longus. On the inside track is fibularis brevis. So those are the two main muscles we have to worry about the lateral aspect of the lower leg. And one other feature of this model which is of interest is the neurovascular bundle passing down the posterior aspect of the lower leg. This neurovascular bundle passes posterior and inferior to the medial malleolus. Here's the medial malleolus, meaning the distalmost tibia, and this neurovascular bundle includes the posterior tibial artery and vein, as well as the tibial nerve. This is not called the posterior tibial nerve, but rather the tibial nerve. But the artery and the vein are called the posterior tibial artery and vein, passing posteriorly around and inferiorly to the medial malleolus.